If PEPFAR is not reauthorized, or if the United States cuts funding, along with other flows of funding for HIV, this can create a gap in service provision for people living with or at risk of HIV, and then there's a good chance that we could see a resurgence of the virus at a time when there are really so many tools available to address it. Hi, I'm Katherine Bliss, Senior Fellow and Director of Immunizations and Health Systems Resilience with the CSIS Global Health Policy Center, and I'm here to talk about my recent brief, Centering PEPFAR in U.S. Global Health Security Strategies. So PEPFAR is the President's Emergency Plan for AIDS Relief. And it's really the largest U.S. global health initiative, and to date has allocated more than $100 billion through bilateral and multilateral programs. By training health workers, strengthening supply chains, building laboratories, and delivering prevention testing and treatment services, PEPFAR has saved 25 million lives and prevented more than 5 million children from being born with HIV. But recent outbreaks, including Ebola in West Africa in 2014-2015, COVID-19, Mpox, and others, have really shown that PEPFAR's investments in countries' health systems contributed to their ability to respond to health crises. So the report is really about how PEPFAR contributes to pandemic preparedness and why the United States has an opportunity to lead globally on recognizing the impacts of work on HIV to global health security and really working with other countries to make sure that work is mutually reinforcing. So 2023 is a big year for PEPFAR. It's the 20th anniversary. The program is up for a 5-year reauthorization from Congress this year, and there are really just a few years left to reach the global goal to end HIV as a public health threat by 2030. So the CSIS Bipartisan Alliance for Global Health Security convened a working group of experts based in the United States and overseas in the countries where PEPFAR is implemented to examine the question of this integration of work on HIV and pandemic preparedness, asking what are the benefits to the approach and are there any risks? So first and foremost, we argue that reauthorization of PEPFAR is essential, both to maintain progress on HIV and to create a platform for leveraging PEPFAR investments and assets for the broader challenge of pandemic preparedness. But beyond reauthorization, we also see that the U.S. needs to be sure that HIV programs and those focused on global health security are complementary and unified. And so the United States can work with bilateral partners as well as multilateral organizations like the Global Fund to ensure that programs and policies focused on HIV are aligned with efforts to bolster health security. The success of PEPFAR over 20 years has helped kind of make the HIV pandemic seem like less of an emergency than it was in the early 2000s. But the fact is that if PEPFAR is not reauthorized, or if the United States cuts funding, along with other flows of funding for HIV, this can create a gap in service provision for people living with or at risk of HIV, and then there's a good chance that we could see a resurgence of the virus at a time when there are really so many tools available to address it. We know, too, that the challenge of another pandemic or unexpected outbreak is high. And so PEPFAR-supported programs have really contributed valuable lessons and built outbreak response capabilities in low and middle-income countries. And so in this sense, maintaining U.S. commitments to PEPFAR and really working to align HIV and pandemic preparedness supports U.S. national security and global health security. To read the full brief, Centering PEPFAR in U.S. Global Health Security Strategies, please visit csis.org.